Enhancing Workplace Civility and Diversity by Felicia Riddick. Workplace Assessment. When assessing the organization, there were some strengths and weaknesses that needed to be praised or addressed respectfully. The organization is strong in their drive for cultural competence, which is evident in their mission statement and physical environment when patients walk in. When managers and leaders in the workforce push for increased cultural competence in the workplace, they help to foster an operative, collaborative, and productive work environment. However, their weaknesses lie in civility amongst nurses, patients, and staff members. In my time there, I personally witnessed many instances of uncivil behaviors that included, but are not limited to, name calling, yelling, and eye rolling. According to Clark, constant exposure to harmful behaviors like these negatively impact the mental, emotional, and physical well-being of nurses, eventually turning them away from certain jobs or even forcing them from the profession entirely. Despite any shortcomings, the organization overall is one that is committed to serving the community, bettering the health of individuals, and providing jobs and opportunities for growth. Goal. As an organization, we are committed to fostering a work environment that promotes independence, respect, and room for growth. In 6 months after implementing leadership style and communication training, the incidence of uncivil behavioral complaints will decrease by 50%. Strategy and initiative. The strategy or initiative that I chose to implement for my organization was diversity training. What is diversity training? Diversity training is a program that focuses on increasing awareness, understanding, and action through two leadership style models, awareness and/or skills training. What is awareness training? During awareness training, informational and emotional strategies are used to draw attention to diversity issues at the core of the organization. While attending training, individuals will learn to address their personal biases and attitudes and also understand how their behavior can affect others. Skills training. The most common framework for skills training is the social learning theory, which encompasses teaching individuals how to model appropriate behavior, receive feedback, use positive consequences, and use self-efficacy. Milestones. There are 3 milestones we would like to accomplish. First, we would like to offer leadership style and communication trainings once a month. Second, we would like for 80% or more staff members to regularly attend these trainings that are available. Third, after 3 months of having training available, we would hope that 20% of reports of uncivil behaviors will decrease. Effectiveness. The effectiveness of these monthly trainings will be measured in 2 ways. First, we will count the number of incident and uncivil behavior surveys from 6 months before training was implemented and 6 months after training was implemented. A decrease in the number of these incidents shows that leadership and communication trainings have been effective, while an increase indicates the need for further training. Secondly, we will also record the number of satisfaction surveys among staff. The survey will ask questions that are pertaining to, but not limited to, job satisfaction, experience with uncivil behaviors, the number of incidents or uncivil reports filed, if any, and satisfaction with the organizational structure or likeliness to leave the specialty. Leadership. The kind of leadership and leadership style that would best suit the goals of the organization would be transformational leadership. The transformational leadership style focuses on the personal qualities and behavior of leaders that inspires others to attain the organization's goals. Transformational differs from transactional because there is no system in which good behavior is rewarded. Team members are simply in awe of and inspired to be like the leaders around them. Conclusion. I have thoroughly enjoyed taking this class this semester and working on this project. From this assignment, I have learned the strengths and weaknesses of the organization I am involved with. While they are culturally competent and open, the lack of civil behavior between staff on staff and staff on patients can lead to decreased job and patient satisfaction. However, if better policies and initiatives were implemented, the organization can work to increase civility, job satisfaction, patient satisfaction, and decrease turnover.